Good day and welcome to the Visioning for Prevention and Upstream Approach conference call.
I will now turn it over to our facilitator today, Louis Gasper.
Hello, thank you, Chris. My name is Louis Gasper, and I'm a young adult consultant with the Capacity Building Center for States, and excited to be here in the role of a host. We have some amazing guests from the Indiana Department of Child Services and as the Stop Child Abuse and Neglect. So that includes Hannah Robinson, who serves as the Prevention Manager of the Indiana Department of Child Services, Matthew Gooding, who is the Assistant Deputy Director for the Indiana Department of Child Services, and David Reed, who serves as the Deputy Director. We also have Dee Sandrowski, who is the CEO of Stop Child Abuse and Neglect, also known as SCAN, and myself. And over the next 45 minutes, we'll be going over different strategies, questions, lessons learned as it pertains to different programs and initiatives that their state has worked for in regards to and related to prevention. So without further ado, please feel free to.
You could maybe, okay. So hi, all. Pleasure to be here. I'm David Reed, and as Louis stated, I'm the Deputy Director of Child Welfare Services for the Indiana Department of Child Services, and it is an honor to be here to talk with you all today about our prevention initiatives that we've had in place here in our state. Some of them for quite some time, some of them are new, and I'm thrilled to be able to have two of my coworkers here with me today, Matt Gooding, my Assistant Deputy Director, and Hannah Robinson, who works so hard on these programs and really is kind of the face of prevention here in Indiana. And I'm pleased to say that prevention in Indiana works, and it has been working, and we continue to make improvements in the services that we are providing to families. And again, it's great that we're able to spend some time with you guys this afternoon. In addition to my coworkers, we also have a really important provider partner with us this afternoon, Dee Sandrowski, the CEO of Stop Child Abuse and Neglect, an agency up in the Fort Wayne area here in Indiana. And again, we're just really excited to be able to talk with you about some of the initiatives that we have here in place and how they fit in to the Family First Prevention Services Act as well. If you could advance the slide, please, Chris, and maybe go ahead and go one more. So as an overview, I just want to kind of talk about what the agenda is going to be like here early during our presentation. The first thing we're going to do is kind of talk about how our agency has really embarked in intentional efforts to serve families further upstream and the kinds of things that we have done to make sure that we are getting to families earlier before they are in crisis. In addition, I want to talk some, this will be Hannah presenting on our work with the Healthy Families America program, which I'm sure many of you are aware of as an evidence-based model with the goal of helping facilitate bonding with families and keeping kids safe. In addition, we'll talk about our Community Partners program, which is a program that we have had in place across our state for quite some time as well, a voluntary program, a prevention program, a true prevention program. And Dee's agency has that service available through her provider agency. We'll talk about how we evaluate these services, so Healthy Families Indiana and the Community Partners for Child Safety program as well. We'll talk a little bit about the Institute for Strengthening Families, which is a conference that we have to focus on prevention. We'll talk more about that. And then some of our newer initiatives that we have developed over the last couple of years. There's been so many changes in Indiana over the last handful of years. We have a new director who's been in place since January of 2018, and I myself have been here at the department just going back to September of 2017. So almost 4 years ago. And then lastly, we'll talk about our Family First Prevention Plan and how we went about creating that plan and kind of where we are in our negotiation process with ACF on that. So if you could advance the slide, please. So what does going upstream mean? And so, again, we have a new director, Director Terry Stigdon, who started with the agency back in 2018. And her background is in nursing. She comes from taking care of people before she arrived at the department. And she learned a lot about the value of prevention during that time that she was serving in the nursing profession before coming to the department. And she came with the philosophy about trying to serve families earlier and not waiting until they are in crisis. In fact, every deputy at the department had to read this book, and if you haven't, I really do strongly recommend it, by Dan Heath, called Upstream. And it does talk about the value of preventing problems before they even happen, and even in a healthcare context. So with that kind of being something that we focus and spend a lot of time reviewing at leadership, and then having our own divisions also read the book and understand how important it is to, how valuable it is to prevent problems before they've actually happened, has been a big focus of the agency. But in addition, we also spend a lot of time just understanding the child welfare research and things like the ACE study, which also talks about the value of prevention. If we can keep ACE scores down, then we usually predict better futures for our kids and for our families. And that's really just good child welfare research that obviously departments of child services across the country should be paying attention to. In addition, we also understand that, you know, kids need protective factors and families need protective factors in order to stay safe. And so we focus a lot of energies in all of these programs that we'll talk about later on this afternoon in helping families develop those protective factors and trying to make sure that we are creating the kinds of relationships that facilitate resilience with kids as well. And we know that from the research that when we separate children from their relationships, we impair their ability to be resilient from any trauma exposure that they may have had. So making sure that we are protecting relationships for our kids is a really important goal. We do understand that both kids and caregivers do better when they are able to be safely kept together. And with that, I'm going to turn it over to Hannah to talk a little bit about our Healthy Families Indiana program. Hannah?
Thank you, David. Hi, I'm Hannah Robinson. As David stated earlier, I'm the Prevention Services Manager for the Indiana Department of Child Services. And so one of the largest programs that we operate at the Indiana Department of Child Services is our Healthy Families Indiana program, which is centrally administered, which means that we have kind of state-level oversight for the program and ensuring that the sites or the provider agencies that are implementing or providing the Healthy Families model, are meeting the fidelity standards of the Healthy Families America model. So we have had Healthy Families, or we have invested in the Healthy Families program since 1994. On average, we serve about 10,000 families a year. We did see a slight decline in the number of families served in 2020. Our target population for the program is prenatal women and postnatal women, with the effort to engage them within 2 weeks after the birth of the child. The Healthy Families program uses several assessment screens and tools to monitor ongoing safety of the children that are involved in the program. And we also require that our sites that are contracted to provide Healthy Families address a specific list of safety topics with each of the caregivers that they are working with, and that includes kind of an overview of an education on safe sleep, car seat safety and car seat installation, information about blunt force trauma, and water safety, shaken baby syndrome, postpartum depression, fire safety, water safety as far as drowning, as well as temperature for baths. And we have set an expectation that those safety topics be reviewed within the first contacts with the family, as well as anytime there's a new caregiver engaged with the family. So ongoing safety is always monitored. We use the parent survey assessment tool to identify kind of areas of concern that will then be addressed with the family through intervention strategies. So ongoing safety is always something that we're looking at and focusing on in the Healthy Families Indiana program. You can advance to the next slide, please. So our Healthy Families program, we also have funding that we receive in partnership with the Indiana Department of Health through MCV, which is Maternal Infant and Early Childhood Home Visiting funding. We've received MCV funding since 2010 through formula awards and also through a few competitive grants. We are consistently, meeting benchmarks for MCV in our 7 MCV-funded Healthy Family sites. And in 2020, we met improvement expectations for all 6 of the performance measure areas. We also have invested in the mental health consultation enhancement for our MCV-funded Healthy Family sites, and they provide clinical assessment and monthly case review for all of the MCV families that are served by those sites. We also have, evaluated our mental health consultation enhancement and have, from that evaluation, found that the families that have access to MCV-funded sites where mental health consultation is provided have higher home scores for the families. We have higher compassion, satisfaction, self-efficacy, and resource quality for the home visitors. And so we've really kind of seen benefit to including that mental health consultation enhancement to our Healthy Families sites that are funded by MCV. Next slide, please. So our Community Partners for Child Safety program is also a statewide program that we have available that really provides primary, secondary, and tertiary prevention services in all 18 regions of our state. In the last federal fiscal year, we served about 23,000 families. We started the the Community Partners for Child Safety program in 2006 after we had piloted in just one county, our largest population-wise county in the state, Marion County. And we really developed this program after we saw that we had a lot of families that were assessed by the Department of Child Services and had some needs, but not as a result of child abuse or neglect. They really, needed some connection to resources, but not necessarily formal intervention from the Department of Child Services. And so our Community Partners program is available in every county and every region of the state, And we receive referrals for the program from various referral sources. Our primary referral source at this point is the Department of Child Services, but we also get referrals from schools. Individuals can self-refer to the program, and various other community agencies connect families to community partners. Advance to the next slide, please. So the Community Partners program has some flexibility. They really are able to accommodate the needs for the communities that they are serving. A portion of the funding that they have allocated to them, 30%, can be used to support other prevention efforts or prevention programming in the community. They also have the ability to, fund certain projects or supplies so that families have the ability to access resources outside of the connection to the Community Partners program. As far as like primary prevention, a lot of the Community Partners agencies do community outreach events where they may offer safety fairs or do education on water safety or safe sleep. Many of the Community Partners agencies have invested in doing billboards for things like safe sleep and child abuse, physical abuse, as far as choosing your partners wisely. It was one of the billboards, because your child's life depends on it. So there's been a lot of primary education efforts or primary prevention education efforts that are offered by the Community Partners agencies, as well as secondary efforts in providing direct service to families. In the direct service that is provided, they utilize evidence-based programs to provide things like parent education, and then they also have the ability to provide concrete support to families or concrete assistance to families when they are unable to access that through another resource available in the community. Next slide, please. We evaluate both our Community Partners and Healthy Families programs. The Community Partners program completes the NCFIS assessment at intake for all families served, and then again at termination if the family has received at least 8 or more face-to-face contacts. They are also now utilizing the protective factor survey and completing the pre and then the post survey if the family has received 12 or more face-to-face visits. Healthy Families, we have ongoing quality assurance and fidelity monitoring in place through a quality assurance and technical assistance contractor. Each of the Healthy Families agencies receives a site visit annually to ensure that they are meeting the expectations of accreditation for the Healthy Families model. In addition to those evaluations that were referenced, the Department of Child Services matches families that have participated in both the Community Partners and Healthy Families programs with our Child Protection Index, and have been able to demonstrate that both the Community Partners and Healthy Families programs prevent families from entering the child welfare system. Advance to the next slide, please. So our Institute for Strengthening Families, as David referenced at the beginning of the presentation, is a conference that we offer twice a year, typically in the spring in April or May, and in the fall in August or September of each year. This conference is really an opportunity for continuing education for both the Community Partners and Healthy Families program and other home visiting and prevention, early intervention programs that are available through the state. It's really a low-cost, high-quality opportunity, and we have a planning committee where we identify kind of topics of interest or areas where the programs are struggling, you know, in their work with families or need some more education. And so it's really been an opportunity to bring training to Indiana that's really going to assist the direct service staff in their work day to day with families. Next slide, please. One of the new initiatives that we have just started working on is the creation of what I generically call, or what the project group generically calls, a helpline. And really what this is work towards transforming our state from a mandated reporter state to more of a mandated supporter state. And what we have done is added an additional prompt to our child abuse and neglect hotline that allows callers who may be calling for themselves or another family to connect them directly with our Community Partners program if they need information about resources or support to help them with things like children's behavior, utilities, food, parenting, any of those things. Then instead of being connected to the Child Abuse and Neglect hotline, they can be connected directly with our Community Partners program where they can receive connection and support. This new project or helpline, as I like to call it, has not really been marketed yet in our state. We're still kind of working through how we can share that this is an option and how we can really connect families to the supports that they need to ultimately prevent them from ever being in contact with the child welfare agency, if at all possible. Another initiative that started in 2020 was the development of what we're calling now the My Healthy Baby program, previously the Indiana's OB Navigation program, which is a three-agency initiative between the Indiana Department of Health, the Family and Social Service Administration, and the Indiana Department of Child Services that has really been tasked with trying to reduce the infant mortality rate in the state of Indiana. And this project really works to connect women, prenatal women, to home visiting services. It works by receiving information from the Family and Social Services Administration or our Medicaid office for women who have been determined to have presumptive eligibility or have applied for pregnancy Medicaid or are existing Medicaid recipients that have indicated that they are pregnant, and that woman's information is then provided to the Indiana Department of Health Mom's Helpline, and call specialists at the Indiana Department of Health Mom's Helpline are then proactively reaching out to women to let them know about home visiting programs that they may be eligible for. And if the woman contacted is interested in participation in home visiting, then they are directly referring the mother to either our Healthy Families Indiana program or Nurse Family Partnership or parents as teachers, or early Head Start, or any other kind of locally grown home visiting program that we have available in Indiana. This initiative rolled out in the first 22 counties of Indiana in 2020, and then additional counties will go live in 2021 with the expectation that we will be fully operational statewide by the year of 2023. Next slide, please. Now, I guess it's time to turn it back over to David.
Thanks, Hannah. I'll jump in. So, I mean, obviously, there's a lot that Hannah kind of oversees there with those prevention programs across the state, and they're interacting with tens of thousands of families all across the state with great success. It's a thing to really highlight as well, that the families that participate in Healthy Families Indiana and Community Partners for Child Safety, we almost never go on to have a formal child welfare case with those families. That said, it's been pretty well documented that Indiana struggled historically with keeping families together when families did have formal DCS involvement. And that was a real clear goal of Director Stigdon when she started in 2018. And it was called out in some other kind of analysis of the department back when I first started in late 2017. We needed to find ways to keep kids safely with their families. Healthy Families Indiana is certainly a big part of that, but historically that's been a voluntary program and a voluntary program only. So we need to work on what do we do with families who we do have a reason to be formally involved with them. There's an assessment that we were called in on, we investigated, we substantiated that assessment was true. What do we do? How do we help that family, and what should our goals be? So we identify, again, keeping families together as a primary goal for our state, and to help us achieve that goal, we developed the second bullet point there, something that we call Indiana Family Preservation Services. And I wish we had more time to talk about that initiative as well, because there really is so much happening with just that one program, let alone Healthy Families and Community Partners and My Healthy Baby and the other things that are also happening across our state. It really is a pretty exciting time here in Indiana. But the Family Preservation Services program has basically the same goals as Family First. We use evidence-based models with the primary goal of keeping families together. But we go a little bit further. It's evidence-based models, concrete supports, the development of protective factors, and a real focus on safety. If I were to describe that initiative in kind of 4 ways, it would be that: evidence-based models, concrete supports, focus on safety, and the development of protective factors. And we shifted how we reimburse our providers for that service. We have 96 providers across our state who have that contract, and that is for families who do have an open DCS case. So again, we investigated an allegation, we found that to be true, but we didn't remove. We brought in supportive services to try to keep that family together safely. And fortunately, since we developed that program with that focus on evidence-based models, concrete supports, focus on safety, and protective factor development, we are doing much, much better with even keeping those families together also. We've always done well keeping Healthy Families and Community Partners families outside of our system in formal ways, but again, we've struggled with those families that did have a substantiated allegation. So we really worked on that as well. And again, that lines up with Family First. And again, given that we've had Healthy Families across our state for literally 25 years, the program has been around Indiana for 25 years with phenomenal outcomes. When Family First passed back in February of 2018, we started thinking about, could we utilize the upstream approach of Family First to be able to capture the families that are currently receiving Healthy Families Indiana in our definition of foster care candidacy. And as I'm sure you paid attention to models being added to the Title IV clearinghouse over time, Healthy Families landed there as a well-supported model, which made it very attractive for Indiana. Could we find a way to maximize the inclusion of Healthy Families America as a well-supported model on the Title IV clearinghouse and use that in our own development of our own prevention plan. And so we have submitted to ACS our foster care candidacy definition that would include those 10,000 families annually that participate in Healthy Families, with the goal of being able to use some Title IV supports to help support that program that, again, we get phenomenal outcomes from. So we're currently in negotiations with ACS about that, but they're very optimistic that that will be approved because, again, it's a well-supported model. It has a clear goal of keeping families together, and that's how it's utilized here in Indiana. We facilitate bonding with high-risk families, and the result of that intervention is that we don't meet those kids in formal ways down the road. So, and then you probably are also aware that there is the Child Welfare Protocol now developed by Healthy Families America, and our providers that are delivering Healthy Families Indiana, we call it, can utilize the Child Welfare Protocol within the provision of family preservation services. The other kind of uniqueness with family preservation services is that it's the providers, the experts across our state, who decide what specific model to utilize to achieve the goal of keeping that family safely together. We don't pick that for them. We send you a referral. We pay you a daily rate for your interventions, and we expect you as the experts to make good decisions about the best way to intervene with families to achieve that goal of keeping them safely together. And really shifting that burden to the providers deciding the right way to intervene really has helped, I think, drive improvements. And we, so far, point-in-time data, we're about 14 months into that service now, which is available statewide, every county in Indiana. So far, we really are demonstrating really good work, and we're very optimistic that will continue going forward because a very small percentage of the families that have received that service have gone on to have another incident of maltreatment that was substantiated, and almost none have gone on to experience a removal, whereas historically we had very, very high rates of removal and repeat maltreatment for families that were those case types. So our in-home children in need of services or in-home informal adjustment cases. So that's another, if we should have more time, we can talk a lot more about that initiative as well, because I really feel like that's going to help us keep kids out of foster care and safely out of foster care as well here in Indiana. I know we only have about 10 minutes left. I think our next agenda item was to do some panel discussion. So, Louis, are you there?
Yes, I am. And no worries at all. It's always a great problem to have when there's so much information to be shared. So I'm going to ask that if everybody unpause themselves, do it for our last panel round. And we will just be going through some quick questions. Thank you so much for going over your programs, including the Institute for Strengthening Families, Community Partners for Child Safety and Health Families of America. So my first one is about the relationships and partnerships in order to create these range of services that you've been able to build. A lot of times we talk about, sister agencies, community providers, but these are pretty, uniformly important, we know. So tell us about some of those challenges that you faced, like within creating this service array, and then how your team has really persevered through it to make these things sustainable.
Well, I'll jump in with that, Louis, and thank you for that question. And, it is a struggle to find resources for prevention. Indiana is no exception to that rule. I think states are often struggling to find dollars to support this kind of programming. And again, it's called out oftentimes in this book. So if you haven't read Upstream, another plug for the book, you really should, because it talks about how we end up being so reactionary as a country. And that's far more expensive than really devoting resources upstream and in prevention. And fortunately, when Director Stigdon came on board in early 2018, that was her focus. And because, she's really able to talk about how important that is, and she's very persuasive, we were able to get resources to support our prevention efforts across the state. And then again, we view family first and the mechanics of that law as another way to really support our prevention efforts across the state.
Great, thank you so much. And I think many people are curious about those types of things. My next question is kind of about programs and the FFPSA core principles and tenets that we have in transforming child welfare. So specifically to the program of healthy families, how is that connected to the vision for prevention? And then, with the community partners for child safety and Institute for Strengthening Families, also how those really aligned and meshed with Indiana's prevention plan goals?
Mm-hmm. I'll jump on that too. Before I do that, I just want to make sure I highlight also that it's not just DCS who needs to focus on keeping families safely together and preventing them from experiencing the hardships of foster care and the trauma that goes along with that as well. It's communities, and agencies like SCAN, like Dee's agency, have been critical, especially during the pandemic, when so many families across our state and across the country were suddenly unemployed, suddenly worried about where they're going to find resources. I mean, basic household supplies were in short supply early in the pandemic. So I don't know if Dee, you want to talk a little bit about some of the things that your agency was able to do during that time.
Yeah, thanks, David. Absolutely, and I'll make this short and sweet. I think, Hannah said it best. We're mandated supporters, and it takes a village to raise a child. So healthy families equal healthy communities. And I think it's part of our message as a community partners provider to really talk to our community stakeholders about what it means to support children, from educational institutions to, I would say, our businesses, to parks and recreation, to all of our other community agencies that provide services to children and families. And I think what was so amazing through this entire process, as Indiana is starting to shift and our language is shifting, and our collaboration between us as providers and my state colleagues on the call, our communities are starting to shift as well. And we saw so much support during the pandemic, but even after the pandemic, around messaging and children and, healthy communities, healthy families equals healthy communities, and who doesn't want that? And everyone plays a part in that. And so, I think you're right, David, as you talk and you have that messaging from foundations to private donations to United Way, they all started to shift their families around children and their funding around children and families, which all then starts to shift really the community support and effort that really takes to continue our prevention work.
Maybe back to your question then, Louie, about how healthy families kind of intersects with our prevention plan. Again, we've had it for a long time, 25 years of phenomenal outcomes from a model that all of a sudden there it is on the Title IV Prevention Services Clearinghouse as a well-supported model. How do we pair that up? How do we leverage Family First to be able to support a program that we'd love to be able to still grow? Even though we impact 10,000 families a year, can we grow it? And Family First was potentially an opportunity for us to do that. So we wrote it into our foster care candidacy definition. We are in those negotiations. That's all a question in the chat about how that's going. We've had great conversations with ACF at this point about our plan. They've asked really good questions. We're coming back with responses to those questions, and we're optimistic we can get that approved hopefully in the very near future.
Thank you so much, and I really appreciate how you're not just highlighting these programs as yourself, but truly the process of embedding them into your larger prevention plan. I think that's so important for really all of us to think about. And to go off of the children and families discussion that we had, how have they been involved in the planning, the review, or the prevention program selection process throughout the conception and eventual submission of the FFPSA plan, or even just initiatives beyond dealing with prevention?
Another topic I wish we had more time to really dig into, because there's been so much Indiana-specific initiatives to listen to folks who have experience with our system. Young people especially. Director Stigdon has been very intentional about creating spaces for young people to tell us about what it was like when they were involved with the Department of Child Services. If they still are, what is that like now? Like if they're in our Chafee services, and we do have some pretty robust services that we offer young people as they're exiting and they're emancipating into their adult lives. But we also have a birth parent advisory board, and it's amazing how much they are able to help us make improvements by telling us what their experiences were like, and they don't hold back. it can be kind of hard to hear what they had to say sometimes, but it's important that we listen. And we have a foster parent advisory board as well to be able to focus on how do we make sure we are retaining high-quality foster kids who do need to come into care. We know we can remove fewer kids than we are, but we're probably never going to bat 1,000. How do we make sure we have resources available and that we're listening to foster parents about their experience with the department as well? So listening to young people and to the parents and foster parents that we work with has been a really intentional focus of Director Stigdon. And providers, too.
Well, that's what I was going to say, David. I think that it's really been important for providers to make sure that they're capturing parent involvement and parent voice, and both our Healthy Families and Community Partners programs include parents on their advisory committees. The Community Partners program has the ability to hire parent partners to provide, service to under the Community Partners for Child Safety program. And both programs also, seek to hire staff that have, received benefit from the program and have that lived experience.
Yeah. I would also just like to add that based upon those programs, as a provider, we certainly do elicit feedback. And as a Prevent Child Abuse America chapter for Indiana, we hold chapter meetings within the communities, and we ask for a number of like families, community constituents, and others to participate in that, so we get feedback not only about our services but what's happening in our communities to then tailor our services if there is any gaps to really then start to support what is needed based upon their feedback. So I think it's really comprehensive, and then we have the ability to share that with our state partners as well.
Thank you so much for all of that amazing feedback, and I know that this is a conversation for much more time, and I hope that we do within our advice reels, which you all should check out. My last question is for Dee, and I'm wondering if there are specific, any stories that you want to leave people with in regards to your programs or the overall partnerships, and then also too, kind of adding a little bit of an extra question, but if there's advice that you could give to participants sort of based off of those stories, what would that be, or those experiences, what would that be?
Yeah, thanks, Louie. I think that we do such amazing work, but we can't do it without our partners associated with that. And so, this is a community partner story, and it actually comes from us with a family that was struggling with being actually in a refugee camp and kind of immigrating back into the Fort Wayne area. And they didn't have a whole lot of resources associated with them. They didn't know how to keep their house clean. They had children that had special needs. And so, as a community partners provider, they called us. They got our phone number. They were a self-referral. We used translation services to be able to connect with them. We actually have a Burmese individual on staff, and so they were able to then go out and really support this family, and doing it in ways with connecting to insurance, making sure that they have connections so that their family, their children can have medical and dental care. We worked a lot with the school systems because the oldest child was autistic and on the spectrum, and so they needed to find ways to connect with that school entity. So really being in there and getting the evaluations that was needed, supporting the work from potty training between school and home and making sure that those resources were there. And then ongoing, kind of creating that, what we call an eco map. What are their supports around them and how can we help support that family, and being able to touch base with them for 6 months and then hand them off beautifully to other community providers. And I think that's what Community Partners does. And I think Healthy Families is very much similar to that. And then when David spoke about our prevention work and our family preservation program, it's really making those connections and pulling in community providers that have that same goal of keeping kids safe. And really making sure that our families have the resources that's needed. And, Indiana has so many beautiful stories about that. And I think that, if I have to leave anything, is don't be afraid to have that conversation. Walk across party lines. Call your colleagues. Step up and pull in people that that can help children and families. I think it just, taking the time to do that and making sure that you're all on the same page from start to finish really helps. Collaboration is the key, and communication is helps to all of us to be very successful. And being a good listener and knowing your resources. I don't know how to sum all of that up except the fact that as I was preparing for this, I was like, hey, Indiana is a really awesome place to be right now. Well, it's always an awesome place to be, but right now with all of the prevention work that we're doing, and you can see the change in children and families, and I think that's what's most important. We're no longer planting seeds and hoping for those seeds to grow. We're watching the change as we're working with them, and that just creates this pulse of just positive energy that is very exciting to see and be a part of.
Thank you so much, Dee, and that is amazing. I wouldn't have wanted to end in any other way than hear about that. And there's so much I want to say, but we don't have the time. Hopefully, left y'all hungry for more because there's more to come. So we have a few different announcements really quickly. Our Capacity Building Center for States, we're building a lot of prevention resources, including a matrix, infographic, literature review, and advice reels, which will contain more questions and videos, like shorter based on this. So please feel free to check out our prevention webpage. And last but not least, the DCS prevention website is also up and available. Check that out too, as they've given us many great resources as well as stories and ideas for how we can move this work forward. Hannah, Matthew, Dee, and David, thank you so much for your time. Everyone else, thank you so much for participating in the event.